military activities in this area, this densely populated areas, would be, of course, an unfathomable catastrophe and an enormous, would even further expand the humanitarian disaster beyond imaginations. A new wave of displacements and would also really give an increase in, of course, in additional injuries due to the military offensive and trauma. It will also increase the burden on a completely overburdened and undercapacitated health system on its knees, and increase the trauma burden, and it will push the health system closer to the brink of collapse. Since November, only for WHO, 40% of our missions to the north, for example, have been facilitated. Only 40%. Since January, that figure is much lower, much lower. These missions have been denied, impeded, or postponed. And approximately 45% of the mission requests for the south are facilitated. That's absurd. Even when there's no ceasefire, a humanitarian corridor should exist, so that WHO, the UN, and partners can do their job. We need a complete, a pragmatic, and a different deconfliction system to be able to actually do our work. The UN, WHO is ready to carry out many more missions, both to the north, to the middle area, and to the south, which we cannot do now. When you look at the attacks on healthcare, we are, of course, gravely concerned, and you've seen this in the news, is about the situation around Nasser Medical Complex. Nasser Medical Complex is what we used to call the Shifa hospital from the south. It had all the specializations. And currently, civilians have been called to evacuate, which is extremely dangerous. The hospital has been reportedly under siege for more than a week now. 10 civilians reportedly killed. And there's also reports that the northern gate being demolished and 2 of its warehouses being almost destroyed due to hostilities. If that's true, because we don't know, we don't have access at the moment.
We agree that the escalating humanitarian needs call for a scaled-up and hindered flow of aid.
We are looking ways how to prevent that attack on Rafah that becomes, very imminent. Netanyahu is, determined that he wants to continue the war for his personal career, for his personal future, and it's very clear that, he doesn't care about, the destiny, the lives of innocent people, both in Israel and Palestine, the Israeli hostages and the Palestinian innocent people, in Gaza. And this is really something that we should deplore and something that we should really stand against, and to make sure that, it is our collective responsibility to prevent further escalation of the situation, further prolongation of the war, or further extension of the war to open other fronts, either in the West Bank or in South Lebanon or anywhere else.